And just going to give it a couple minutes for some people to join. Um, we'll start off with introductions. I'm Marianne Verga. I am co-chair along with Annette Rea of the Family Support Services Advisory Committee. I am the mother of a soon-to-be 29-year-old and with cerebral palsy who attends programs at Lifestyles for the Disabled. And he has self-direction and he does have CDPAP, which is what we're going to be talking about today. Annette?
Hi, good morning, everybody. Happy Mother's Day. My name is Annette Rea. I am co-chair of this council, as Marianne stated. This is my 34th year working under OPWDD. I'm currently the Director of Intake Services at Lifestyles for the Disabled. I have 20-year-old twins. My daughter surprised me for Mother's Day and flew home for the weekend, which was pretty awesome. And my son is a student at Great Hills High School. Um, and I'm happy that you all are here. My son also has CDPAP, so hopefully we can all learn something and pass along to others. So welcome. Thank you.
Cynthia?
Good morning, everyone. My name is Cynthia. I'm the outreach coordinator for the SIDDC. I have a son, Lucas, who attends Great Hills High School. He's nonverbal autistic, and I also have a daughter, Isabella, that attends PS 32.
Denise?
Hi, I'm Denise Purcell. My son Ryan is 32. He has self-direction and he's very busy. Does a lot of things and he travels a lot. He just went to Philadelphia over the weekend with AHRC.
Oh,
And
good,
that's about
good
it.
weekend to be in the city
Yeah, it
as a
was
New
fun.
Yorker.
Oh, yeah, right. But he didn't wear any Knicks outfits because we said you better watch out.
Yeah,
Yes.
really.
Okay.
Jackie?
Morning, I'm Jackie Tripodi. I am the proud mother of Joey Tripodi, who is a twin. They are 33 years old. Joseph has cerebral palsy, multiple disabilities, currently resides in the Constructive Partners Unlimited Residential IRA. I am professionally a family worker at P37R and part of the transition team of the Great Hills High School, as well as I don't know the title, the New York State Institute on Disability, where we provide family support services through a contract for reimbursement, goods and services, as well as tickets and transportation and evaluations for individuals who do not have Medicaid to obtain OPWDD eligibility. Oh, and most importantly, I became a grandmother last week. I I have a very new grandson who was 8 pounds 4 ounces.
Congratulations.
Thank
Oh,
you.
great news.
Leonardo Cataldo is a very Italian name with a very Irish look. So we're very proud and very excited. So we have a lot of good things happening.
Great. Julie?
Hi, everybody. That's so cool, Jackie. Congrats. So I'm Julie Gottesman. I am currently the outreach coordinator for the Grace Foundation of New York, formerly the director of the respite department, but I'm enjoying outreach, doing a lot of community work. I am the mom of Eli Gottesman, who is a ever-growing self-advocate in the field. And and to me, it's what we all do here is inordinately important. So that's why I'm here.
Great. Thanks. Stephanie, hi.
Hi, good morning. My name is Stephanie Cassis. My son Michael, he just turned 31 on Friday. He goes to Eat Into programs. He does get self-direction, and he's on the profound side, so he needs a lot of help. So we also have CDPAP, which I am as well. The DSP for the worker for CDPAP.
Great. Thanks. Um, the person on the iPhone?
Oh, that's me. This is Jay Jambroni. I have a son named Stephen
Hi.
Jambroni, who's 23 years old. He does not have CDPAP. He does have self-direction, and he's currently in the Grace Day Hab program.
I know Stephen. Very nice kid. Fabiana, welcome.
Good morning, everyone. Congratulations, Jackie, on being a grandma. That's always exciting, and it's great that it was on Mother's Day weekend. So you got a double gift. So you're very blessed. So congratulations. My name is Fabiana. I'm with Hope Home Care. I'm the director of intake here, business development, and marketing.
Great. Thanks for joining us. Dina. Hi, Dina.
Hello, everyone. Congratulations, Jackie. That's awesome. My mother says being a grandmother is even more amazing than being a mom. So I don't know what that says about me, but I have been with a very special place since 1998. I've done an array of positions. I'm currently the senior director. I oversee like community and benefit services, and I am also the first chair of SIDDC.
Soon to be chair. Giselle.
Yes. Good morning. My name is Michelle Conan. I'm a broker for Self Direction. I'm also a mom. She's 20, she'll be 22 this November. She has Self Direction. I am her broker, and but she doesn't have CDPAP yet. So that's why I'm here to learn more about CDPAP.
Glad you could join us. Miriam, hi.
Hi, everyone. This is Miriam from Synergia. We offer a housing advocacy program for Staten Island families that live with a family member in the community that are, one member is OPWDD eligible. Glad to be here and to learn some updates. And yeah, thanks.
Great. Sanaya? Sanaya, are you able to unmute?
Hi, I am a mother of a 15-year-old boy who's on the autism spectrum, and I'm here to learn from all of you. Thank you.
Great. Glad you could join us. Wei. Hi, Wei.
Hi, I'm Wei Zhang from CPC. Sorry, I can't open my camera. So I'm a family support coordinator from Chinese American Planning Council. I support the Chinese family from Staten Island and Brooklyn. We have a benefit center, so if your care manager cannot help your child apply certain benefits, or you can't figure out why something happened, you can feel free to reach out to us. We can get someone to assist you.
Great. Thanks. And Jeanette?
Yes, hi. Just got here.
Hi.
I was trying to sign on from my computer, but it wasn't working, so I had to do it with my phone.
That's fine. Yep. If you could just tell us what about yourself.
I have a daughter, Lana. She's 26 years old. She goes to Lifestyles. She receives ComHab 2 through ADSP. She's nonverbal. I was looking to get CDPAP. I've been in the process, but I've been running through roadblocks.
Mm-hmm.
So we're not there yet. So I thought maybe I'd get some help figuring this out.
Okay. Great. Glad you could join us. And Janine, hi.
Hi, good morning. I'm glad I finally was able to hear you now, and I hope
Great.
you can hear and see me. I was having some technical issues. I'm Janine Kirshner. I'm a regional field office administrator for OPWDD. I'm located in the Bronx, and I was recently reassigned to oversee family support services and our fiscal unit. So I'm happy to be here and help in any way I can.
Great. Glad you could join us.
Thank you.
Indy? Are you able to unmute? All right, then. I guess we're done with introductions. So we don't have Kathy Nowak here. She normally gives us an update on statewide activities, but the only thing I can tell you is that we've received the long-awaited statewide family support brochures recently, and Cynthia will have those at any of our events that we're tabling at. And if anyone needs one of those brochures, we're working on getting an electronic copy of it to update the one on the SIDDC website as well. And as soon as we receive that, we'll also update it there. But we will have hard copies at all of our upcoming events, including Friday's General Council meeting, which is at um, IBR, and is that the actual DSP awards, or is that the
I
one?
think the general
It's
council is
June.
virtual.
It's
That's
Zoom.
Yeah.
June.
Yes. Okay. All right.
Isn't it
I,
Zoom? Yeah.
yeah, I'm
Yes.
jumping ahead of myself. That's the June, the DSP one. Okay, so the one on Friday is on Zoom, and we will post a link in the chat in a couple of minutes. So um, the SIDDC, as soon as, well, of course, I'm in my head, I have the June meeting. So, but we will have our SIDDC General Council on Friday. And with that, I'm going to turn it over to Fabiana to tell you all about CDPAP services. I know several of you have said that you have CDPAP. I myself have had it for Matthew since I'm guessing he's about 9 years old. We got it originally, I think, um, when we first started out, that was one of the first services we had. My now 93-year-old mother was his first worker, so it's been quite a while uh, that we've had it. We've had my cousin employed. We've had a couple of ComHab workers that were also CDPAP workers, and now my husband and I are both my son's CDPAP workers. So Fabiana can tell you more about it. It's a great way to find quality workers, especially when um, you know it's hard to find workers these days, and sometimes the best workers you know are yourselves. So and family members, people that you already know. So um, with that, Fabiana, thank you.
Thank you. Thank you for having me today. I'm happy to answer any questions that I can. So as many of you know, the CTPAD program is basically a program where the individual, which is called the consumer,
Where are you? Oh, so sorry.
um, you basically choose your own caregiver, you choose your own schedule, and you basically, you're in control of the services that you have. Um, there's many pros, there's many cons to this program. Um, the pros are that yes, you do get to pick your own caregiver, but that also comes with the con, because if you don't, let's just say you choose your aunt to care for your child, and your aunt goes on vacation, you have to now come up with your own backup. Rather than if you do deal with a home care agency, if Teresa calls out, John can step in and, care for that individual. But when you do CDPAP, you do have to have your own backup, and that the law does require you to have a backup in case that does happen, or if they call out sick. Or, the other pro and con is that if they decide that they find another job, or they need, they move out of state, once again you're stuck now back trying to find your own caregiver. But if you do have a list of people that you can count on, the CT PAP program does work out. It's very beneficial. With this program, everything is actually like the pro also has an equivalent con, because You can, let's just say the family member that's taking care of the individual, and we're going to just say Teresa, just for generic purposes. Um, the person, the child or the adult knows Teresa very well. Sometimes they take advantage of Teresa because they do have that relationship where it is their aunt or it is their family member. So they don't know how to always distinguish what needs to be done compared to what they want done. Whereas a stranger comes in who's the actual caregiver from a home care agency, they're looked at more like the professional, the expert in the field, and basically the person has to follow the direction of that individual. But again, a lot of times in a setting like this where the person has a developmental disability, it's more of a pro to have someone they know because they have already that comfort level. It's hard for any one of us to be comfortable being vulnerable to having someone help us, much less someone who has a developmental disability. It's even more difficult. So sometimes we forget that, that strangers are, not always welcome, per se. But CDPAP is great. You cannot overlap it if the individual does go to a ComHab or a day hab or things like that. But the wonderful part of the CDPAP program is that you do create your own schedule. So if they do attend day hab or ComHab during the day, you can still have CDPAP at night. As long as the two don't overlap, then it works out in sync and wonderfully. Um, it does give you that flexibility of the timing as far as what, clocking in, clocking out. And the person that's really overlooking everything is either the individual themselves or their caregiver, their health proxy.
Fabiana, I have a question about what you just said. So I used to be able to have my CDPAP worker working at the same time as my ComHab worker because the CDPAP worker was attending to their actual physical needs, feeding, things like that, where the ComHab was working on their actual goals. Is that a new rule or is that something that is documented somewhere?
Yeah, it is documented, but it doesn't apply to everyone.
Okay.
So when mention these things, it's more of a broad, every individual is different. It depends on their Medicaid and what the Medicaid allows. But 9 times out of 10, they don't allow it to overlap because Medicaid doesn't want to double pay.
Yeah, I
Yeah.
don't do it so much anymore. I don't do it anymore, but I used to do it years ago.
Yeah, it's the
Had-
same situation where a child goes to school and they have a nurse, like a skilled nurse with them. Some insurance companies allow it, some don't, because it depends on their insurance and how it's set up, to be honest, and what they allow, to be paid.
Okay.
Um, I mean, you are in control. Like I said, it's great that a family member um can get paid. The only thing is, if it's a minor, the parent cannot get paid. It has to be another individual. So if you do have a child under the age of 18, the parent themselves cannot be the CDPAP person because they consider that like your job, as a mom. It has to be someone else. It can't be the mom or the dad, but it could be a grandparent or anyone else.
Fabiana, I just have a quick question. Is it 18 or 21? I believe it might be 21, but I'm not positive because I know my son is still 20 and I can't be his worker, but his sister can be his worker.
Yeah, his sister definitely can. Yeah, it just can't
But
be the parent. I don't know if they changed the age because I think they were considering an adult to be 18.
so I know,
Um,
like with food stamps, even though my son gets SSI, he's not eligible for food stamps because he's 21, and they saying that I should still be responsible to feed him until he's 21, and then it will just be his income. So I'm just curious because then I need to get on the books.
That's crazy in that because
no, you're right. It
we've
is
had
20.
food stamps forever. I'm just saying.
Yeah, it is 21. You're right.
They change
Is it?
things
Okay.
all the
Yeah.
time. Yeah.
Thank
So
you. Just wanted to
21.
make sure we're clarified. Thank you, Fabian. Appreciate
No,
that.
no problem. Yeah, so it is
Matt,
21.
I think food stamps is 22.
Oh, great. And if anybody's seen the size of my boy, you know that I'm counting the days.
Yeah,
Thank
that's
you.
the thing with a lot of these programs is they change the rules and a lot of the rules are moving targets. Sometimes it depends on who you talk to, what workers are educated about certain nuances and which ones aren't. So, if you ever encounter something where you do think there is a rule, look for it in writing on a website or some sort of document, and then go back to them and elevate
Yeah, and always make sure it's a .gov that you're looking into because
right.
a lot of sites are, they give you misinformation. So as long as it's a .gov website, then you know that it's accurate because there's so many different agencies out there or trying to sell things that just are just not in the best interest of the individual. So just when and in anything in life, whenever you're trying to verify something, the best thing is like those government agencies, they'll give you the most accurate information. For anyone who is interested, the new company now that is taking over the entire CDPAP program is PPL. um, their, Governor Hochul, she's so wonderful. She only agreed to one agency taking care of the entire CDPAP program. So everyone does have to go through PPL. It is tedious, but you do have to keep calling and calling. They say the best time to call PPL is early in the morning, like 7, 8 a.m. to try to get through to someone and then just keep trying because they probably won't answer the phone right away because they are overwhelmed. But that's probably your best bet is first thing in the morning.
Yeah, and I found a lot of times if I had questions, I went through the facilitators, their official facilitators. My CDPAP was handled by Chinese American Planning Council before it was consolidated and moved over to PPL. So Chinese American is still one of their facilitators, and I find if I ever encounter a big problem, I go to them first, and then they're able to get me somehow connected to somebody at PPL. Because yes, PPL is a nightmare, Angela.
Yeah, the facilitators are your best bet because they are smaller agencies. The likelihood of actually getting someone on the phone is much higher than trying to actually call PPL themselves, and they can still assist, equally.
Do you need a facilitator? Because I've been trying to do it on my own and I keep running through roadblocks.
You do need a facilitator, but you can go straight through PPL. But you do need.
PPL is telling me I need a referral from my LDSS sent to their portal. I had the independent assessor program come and approve her. I sent everything over to HRA. I've had the hardest time getting through to them that I showed up at their offices. Now somebody came here to my house and did a home visit. I'm waiting for a nurse and they told me I could start to register through PPL. But they tell me that I need them to send a portal and they don't know what they're talking about, the people at HRA.
Contact CASA.
That's what I'm talking about, CASA. Yeah. They don't know. They said they never heard that. They had to send a referral directly to the portal. So now they're looking into it for me. And I've been doing this for months. Okay.
Yeah, I would definitely consider using a facilitator because they deal with this on a daily basis. They know exactly what the requirements are. You usually just need an M11Q from the doctor, and usually that's how they get started
Which
with
I
all.
did. I
Right.
did all that. It's all
Yeah.
done. I've done
Yeah.
everything.
So it's usually M11Q,
Yep.
then the independent assessor, they're
Done it.
supposed to approve it. It's supposed to kick off. Then you're supposed to process your workers through PPL, and then then everything's supposed to just start. So
Well,
I would check in with the independent assessor and see if there's
I,
what is an
I,
LDSS?
Your local Department of Social Services, which is
Okay, yeah, yeah.
basically
So yeah,
CASA. Yeah,
that is
yeah.
right. So that's
Because
CASA.
yeah, she had Medicare/Medicaid, so I don't have I didn't have like an insurance directly to go through, so I had to go through the Medicaid part of it, I guess.
Mm-hmm.
I don't know. I've been making a million phone calls and I keep getting stuck. I've been doing it for like 4 or 5 months now.
Did you elevate it down at HRA? Did you go up to like a manager or somewhere along those lines?
I went up. Well, now I finally they came to my house after I went to CASA. They sent somebody here to do a home
Was it
visit,
the nurse or the home or the social worker?
the social
The,
worker.
yeah, because I usually get
And
two
the,
visits.
the
I
nurse
get
is,
a nurse.
I'm waiting for the call from the nurse. That's my next thing, and she hasn't called me yet. But
Yeah,
they told me the
once the
social
nurse has
workers,
called you, you pretty much should be set and ready to go.
okay, because the social
Within
worker
a week
told
or
me I
two
should
after
be able
that.
to register now, but I can't. They said it has, so will the nurse put it through to their portal?
It sounds, my experience has been that the nurse is the final step.
Okay.
Usually a week or two after the nurse visit, you're ready to go.
All right. So
And
I'll give it
The
another
nurse
week or
makes,
two.
So
that
you're
is
very
nurse
not
close.
true.
makes,
It sounds like you're very
Oh,
close.
all right.
the nurse makes the recommendations for the hours.
Right.
This is why it's the
Yeah.
last step. So you should be fine. You're on the right track, actually.
All
You
right.
just
All
have
right.
to be patient. I know it
But
takes a lot.
it's
But
hideously,
did you register your caregivers? Because
Well,
you don't want the services to start and then your people are not ready.
well, that's what I thought. That's why the social worker said I could start the registration process, but they told me they can't start it until they send the referral.
Jeanette, find out from the social worker who the nurse is and what company she's coming from, whether it's Anthem or what insurance
Okay.
company, or is it from the state?
She's coming from
Okay.
CASA.
Here's
She's
the
coming from
thing, you have to babysit these people. You have to be on top of these people. It's disgusting.
well, it's
Okay.
very
I've
hard to
gone
be
through
on
that
top of
process, the
PPL
social
because they,
worker.
yeah.
I got nothing yet. They gave me the hours. I was approved for the hours, and I got nothing yet. So what do? There's no portal, there's no direction, no communication. I
No.
have to call the social worker that came to the house. I went through all of that. It's a disgrace. They really are a disgrace.
Does
Yeah,
PPL have headquarters in New York anywhere? Because I'm ready to go there because I sent my M11Q 2 months ago and I still heard nothing.
Yeah.
4 times. I submitted in every single way possible the M11Q and I heard nothing. Anyway, but do we know if PPL has an office
no,
in New York?
no.
They were supposed to have one and they never opened it up they were supposed to open up in Manhattan and they never did.
Right. That was
Um,
part of the whole contract. The whole reason
correct. That was the agreement.
Hochul brought them in was that they were
Yeah.
going to bring their headquarters to New York and start employing New Yorkers. And
Where
it's
Correct.
are
a
they?
real bait and switch there. So,
Correct.
Where are they?
yeah.
They're in Philadelphia, if I'm not mistaken. I think they were, yeah, somewhere in Pennsylvania. But you're better off going to a local facilitator, honestly. I think like Chinese American, I think Anchor is one of their facilitators, if I'm not mistaken. I would go on their website and get, a list. Yeah, Special Touch is one of their facilitators. Once you deal with a local agent,
Excuse me, can everybody mute themselves, please?
I
Because
have,
there's a lot of
I just have a
background
quick
noise.
question. Let's go with the fact that I have no idea how you guys get this all started. I don't have CDPAP, but I work in a public school where a lot of families are looking for it. What's our first step? Because you guys seem to have gone, like you're at all different levels already. But if I want to introduce a family member to go into CDPAP and to start to see what kind of Medicaid they have, and I know they don't have care management yet. Where do I send you? You mentioned I hear facilitators, and forgive my ignorance, but I am not privy to this, which is why
So, Jackie,
I'm always learning.
I posted a link in the chat where it says understoodcare.com, and it kind of has all the steps listed in there. So that's a good link to start. But go ahead, Fabiana, if you have any light that you could shed on that.
And then just the type of Medicaid, because I know there are different codes and paces. than
They
Medicaid?
do.
Because I
Yes.
do have a parent here at 37 who has CDPAP and has overlapped with her respite. And I was like, well, that's double billing. And my understanding is that, and this is extensive medical needs for this young man. So I don't want to give her misinformation, but I also want to make sure that she understands, because she brought something up on Chat GBT or whatever the heck that's called. But that, I'm like, all right, but just because you showed me this doesn't mean that it's true. So
Right.
I want to
That's why
make
I
sure
said
that we
you
give the
always
right information.
That's why I say you always have to verify the information on a .gov type of site just to verify that, but you are right. They cannot double bill, which is what I mentioned earlier. But with respite, sometimes they can bill through Medicare. If the individual has Medicare, you can bill Medicare for respite and not Medicaid. So maybe that's, you have to keep that in mind. You can bill, and have those two services. But if I had to guide somebody, the first step with CTPAP is to go through PPL or one of their facilitators. Go on the PPL website, check out who the facilitators are, and then start with them. Tell them I'm interested in enrolling in CDPAP. They should, because that's what I used to do when we were doing CDPAP, when we were allowed to. I guided my patients, my consumers, step by step on what they needed to do. And I would always, the MLMQ has to be done right away, and it cannot be older than 30 days. So even if they went to a doctor 3 months ago, it's no longer valid. It has to be done within the last 30 days. And they have to push, because every 30 days that MLMEQ expires. And so then they have to go again and then again. Every 30, if the person that's handling it doesn't do it quick enough, you're the one stuck taking your child or, what, your family member back to the doctor again. It's not always easy to get appointments, and these doctors get annoyed because, like, oh, we just did this, and so, it's, you have to really, like, be on top of it. But if I had to guide you, Jackie, I would say either call PPL or go on their website, and get the list of facilitators. That would be the first step, and get somebody who knows what they're doing. And they have a few, so they have, I would say, about a dozen facilitators, maybe less. If you don't like what you hear from the first one, you call another one, because they're all the same. Any one of them can do it. So it doesn't matter. You just got to get that right person, that is educated in this program and can help you and assist you. And Jackie, you can call, you could call me if you have any questions, even though I don't do it anymore. I'll guide you as best as I can, or the parents. I could come to the school if you want and answer questions. We don't mind doing that.
I just put in the chat the person I use from Quality Touch. I had Homospic home care prior to PPL taking over, and
Mhm.
during that transition, Homospic, in my opinion, just kind of put their hands up and they weren't answering any questions I had after PPL joined. So I
That's
switched over.
correct. That is
Yeah,
correct.
right? Isn't that they just kind of just
That's correct.
everything
That's
was
what
I
they
don't know,
do.
I don't know, I don't know.
That's
So
what
I
they
put
do.
Quality Touch in. I gave the number. I did switch over to them because of that, and they've been a little more responsive.
Mhm.
They
So
do get paid though, which is unfortunate.
it is, yeah. But
Yeah.
that
Uh, the whole PPL transition was rushed, and plus it was being legally challenged at the same time. So I'm sure that they didn't invest too much in their hiring with enough notice. So everybody was really learning as they were going into it, and a lot of them didn't get the right or full education on this on the program, and then it turned into they seemed to take the approach of an insurance company where they stopped answering the phones and stopped responding to people. They're still being challenged in the courts. I think many of you saw that Dr. Oz, the head of Medicare and Medicaid, sent a letter to New York State, and his primary target was the CDPAP system. He believed that it was rife with fraud. But the whole reason that Hochul did this was because she was trying to eliminate the fraud that was believed to be widespread in a lot of the decentralized system. So it was her choice to centralize it through PPL and then make them responsible for any, just one company would be responsible if there was fraud. So I think that they took it on and had to, you know, belts, suspenders, everything to make sure that there was no fraud taking going on. And then at the same time, start the company, enroll hundreds of thousands of individuals, workers, and then hire their own staff at the same time. It was a cluster, you know what? And it was all supposed to be done by April 1st of 2025. And here we are, May of 2026, and it's just starting to get in order. It's not 100% there yet for sure. But I know I never had any issues previous to it being taken over by PPL. My experience was my worker that I had at PPL quit because he wasn't getting paid for the first month after the takeover. So then there I was supposed to be the backup worker and I became the primary worker. And I had to bring in my husband, who had recently retired, to now be the secondary worker. So we don't have other children. I don't have a large, extensive family or a lot of people nearby to be other backup workers. So, like when I look for workers, I post the job either on Facebook or social media or through word of mouth when I'm looking for a worker. I would prefer to have somebody else because, I'm also a caretaker for my mother, and I also try to hold down a part-time job, and I'm also doing work in the council. So I would love to have another worker, but it's not like the FIs where they sometimes help you find workers for ComHab or Respite or something like that. PPL, you're really on your own. You have to find your own workers. So that for me has been the biggest problem because just finding anybody that's willing to even take this on when the company itself is so screwy and the system itself is so screwy, most people don't want to hop on that train. Wei, go ahead.
Yes. So something extra about the PPL fort. I probably one of the people reported the fort because I know the kids, I know the mom, and I know the schedule they're supposed to take care of the kids. And I saw the kids walking along on the train station when I go to my central office doing a report. And I honestly tell the mom that it's not gonna allow to do it because you're on report to take care of kids. Don't leave him alone at somewhere else, not to borrow his residence. You know what I'm saying, right?
No, I'm confused.
So the mom neglect my suggestion,
Mm.
still doing it. A few months later, I saw the kids again. Luckily, it's Brooklyn, not Manhattan, that crazy. But I decided to report to our home health aid department about his parents. I I honestly believe that if you are a good parent and you decide because you know your child the best and you take care of it, you should not go away when you're on clock on the time you're taking care of the kids at PPL. And are you all agree with that?
Yes, well, I mean, you
Yeah,
have
that
responsibility
is
to
the
your loved one,
people most likely. Yeah, that's the people
That's
most
the fraud.
likely is the fraud investigation should be due on.
right? Mm. Yeah,
Yep.
I think the widespread fraud was more at the billing levels and large groups. I think uh there were fake workers scams. There were fake
Yeah.
client scams. There were a lot of
Yeah.
scams. But you really have to be like a criminal mastermind to figure out those levels of scams.
Yeah, because on me, the only thing I concern is the individual get
Yes, of
the
course.
appropriate care. That's the only thing I care.
Mm,
I don't care who did that to the kids, the mother, the sibling, the worker. I mean, as long as whoever did that, I don't think I should give mercy to them. I would remind them, don't do it anymore. But if you don't listen, sorry about that.
got it. And
Yeah.
Angelica?
Hi, I just want to share something quickly from personal experience. Um, my M11Q, the doctor's license number was not clear, the stamp that the doctor puts on, and that's why it was delayed.
Mm-hmm.
No one let me know that until I went to CASA, and the woman at CASA said, "Are you sure everything on that M11Q is clear?" I said, "Yeah." I kept reading it over and over. I do the same thing every year. Then I noticed the stamp of the doctor's license was not clear. And she said, "That's it. That must be it." So
Yeah.
now, CASA faxed it for me twice. Nobody looked at it. I'm like, I wish you would have looked at it back in March when I gave it to you. I would have known to correct that. So I
I've
went
had
back to
my
the doctor.
M11Q bounced on me year after year and then they don't tell you the reason.
Why?
They just tell you there's a problem with it and you're
Right.
scouring it. It's like they like to play mind games with you.
Just
Yeah.
just this year, I sent my son's M11Q just a couple months ago. I mailed it, I faxed it, and I emailed it all at the same time. And I get a letter saying that the services are going to be discontinued because they never received the application.
I
So
had my
I have
services
a
discontinued.
contact at CASA who has helped me, and she is phenomenal. I don't want to put her name in the chat because I
We
don't want
know
to
who she
get
is.
into her.
We know who she is. We all
But
know.
she's phenomenal. And I said, listen, I'm not doing the M11Q again. It's not my fault. I have proof that I faxed it. I have proof that I emailed it. I don't have proof that I mailed it, but and she said, email it to me again. And I did. And I did. Luckily, it was backdated. Luckily, my worker agreed, and she was pretty much working without getting paid because she knew it was going to be backdated. But this was when, Marianne, you'll appreciate, when my mom was in ICU
Mhm.
and my son was home during spring break, and it was just, I really needed the help at that point. And
3 years ago, I had my services suspended because of an M11Q, and I had FedExed it. I had
No.
a signature and everything. And it didn't matter. I still had to go all the way, start from the beginning, and go through the independent assessor all over again. I was on the phone on a road in Lake George with the independent assessor, rolling through these hills, on my way to a conference, trying to get my services back
So
desperately. So
all
yeah,
I know is I plan to
they
go to
put you in the
Brooklyn on
loop.
Wednesday. If by Wednesday I don't hear anything from anybody, I'm going to Brooklyn where it has to be sent because I need it done. I don't want to go through PPL. I don't want to start all over again. This is very important. Nobody seemed to take any responsibility for it except me, um, which is fine. It's my job, of course. I don't mind doing the work, but at least I want someone to be responsive back. So I think what we should do is, I mean, Marianne, I just have a suggestion. Maybe some Q&A to send to like the email that to the group and some answers like what to look for. And if you feel, if that's possible for the parents, because there are so many different pointers we get from so many different people, but all the information together is extremely helpful. So if
Mm.
we could just put all that together, because it seems like we cannot get straight answers from PPL. And on the other hand, this is their first renewal. May 31st is the first renewal for everybody in New York State. So PPL doesn't have answers. They are not trained to do this. No one there is trained to do this. So we have to pull it together and do it. But also,
Yeah, it's a perfect storm
NIS,
with all the Medicaid issues on top of, at the same time, Medicaid renewals and M11Qs and everything else flying around, and then PPL thrown into the mix. It really is a
so,
perfect storm.
so the New York State.gov, the education department that a lot of the agencies utilize for training, like the sexual harassment, the brokers go on there for training. On there, I wish they would have, I try to look for it. I wish they had some information about PPL because they have, anybody can register to take the course. So I've been taking the Medicaid, Medicare course like 4 times now. And every time I take it, I learn something new. The facilitator presenting is one is better than the other. So someone said to me, you have to take this for the next 5-6 years to really understand everything. I said, I'm in, I'll do it. However, hopefully, maybe we can ask, I don't know who, Hokul or somebody to put some kind of training webinar on NewYorkState.gov so we can go on there and I'm going to train to see what I need to do. I'm fine with that, but at least it has to be available. So I'm not sure. I'm
Yeah,
trying to figure
I think it's a tricky time right now because of the federal government trying to audit and trying to get New York State caught on some sort of error or problem or technicality and everything else with the whole CDPAP system. So I think that right now they're trying to keep as little public information as possible about PPL until this blows through or they pass the audit. So, it's kind of one of those tricky times, but I agree. There should be more information about it because it does seem like this mystery program, and it's shrouded in mystery. But the fact is, there's so many parents and families that can benefit from CDPAP. When they're beside themselves, sometimes parents are exhausted and beside themselves, but if like all of a sudden, they could actually be paid for doing this type of work that they'd have to do anyway. But the fact is, if you actually get paid for it, um, it can relieve the burden elsewhere, and help out elsewhere. When you're trying to choose between taking care of your loved ones or getting a job to put food on the table or keep the lights on, you know, this can be a lifesaver for a lot of families. So it should be more transparent, but maybe it'll take a little while.
I have a quick question. I was just looking at like the Quality Touch website to try to get the facilitator, but you need a PPL ID. It's showing, and to get the PPL ID, I can't register with it yet. So you can't get a facilitator until you get that PPL ID.
So Jeanette, if the number in the chat, because I use them, they'll answer some general questions without being signed up as their facilitator.
Okay.
So you can call them, and then if you like what they say, then you could sign up.
Okay. All right. Because yeah, you can't do it. It's showing without that. All right. I'll call. Thank you.
Marianne, can I just add to what you said earlier?
Absolutely, absolutely.
And another frustrating thing I feel like is, it does relieve, as a parent, a single parent, it does relieve the stress of getting the money to put the food on the table, right? Like you just said. But I still don't understand why they would think, because either way, our children are eligible for these services. So what's the difference when you bring a stranger in the house, right? They're gonna be using that money for that. Why would they say, "Oh, we don't want to pay, a family member versus
Because
a
what they
stranger?"
told me was
Question of parental responsibility.
that's what they told me. It was my job to take care of my son,
Right.
regardless of diagnosis or not.
But
But I don't know
they're
how.
not saving any money if they're gonna still have the funds for a stranger to come in the house,
Yeah,
right?
they're not
Agreed.
right. They're doing
Agreed.
it more on a principal basis than a money saving basis. I'm sure that it's a deterrent to many, and they save money that way. But the fact is, parents, everybody knows, like, they said it a million times yesterday for Mother's Day, like, how many hats does a mother wear, and how many, jobs does a mother's job is like, if a mother got paid for all the work that she did, she'd earn like something like $300,000 a year if she did all those jobs independently. And so, like, when they draw the line there, whether you're 22 or 21 or 18, the fact is, when we are taking care of somebody with special needs, it really doesn't matter what age they are, because age is not relative with special needs.
I
There's
want to jump
special
in
age.
though. So unfortunately, as we know, like there's always like a bad seed that ruins it for everyone else, and that's kind of why this program is set up the way it is, because there are parents who did want to get paid to care for their child just to get paid. And
Yeah.
they, like Wei said, that like that parent wasn't taking care of their child. So unfortunately, they do make it their parents' responsibility to care for your child, which it is normal, that's part of parenting. And you're not allowed to get paid until the child reaches adult age, which is 21, because then by law, you're no longer required to care for that individual because they're an adult. Supposedly, under the law, they're now an adult. They supposedly are supposed to care for themselves. But because they are special needs, that's where you are able to get paid now to continue to pay, to care for that child or that, that individual, I should say. But these programs, once they work, they work great. Again, it's just finding that right person who's knowledge, who has the patience to help you, and who's willing to help. But it can be a sibling, it can be your mom, your grandparent, and like Mary was saying before, that you have to find somebody. It is hard to find someone because as a parent, you're doing it all day long. Sometimes you want a break from taking care of your child. You want that. It is exhausting all day, and especially when you're juggling so many things. So, not everybody wants to do it 24/7. They do want that break, and that's what this program is for, to give the parent that break.
I wanted to say something because I don't know how to raise my hand on the stupid computer. So I'll raise my hand. I don't know where that button is, but anyway. I just want to clarify something, Fabiana, right? So one of the reasons there's a few reasons why I never looked into this, but one of the reasons was I thought that if you collect Social Security and you're under your full retirement age, you can only make a certain amount of money a month. So that has, right? Am I right that has, I don't know what the right word is I'm trying to say.
Yeah,
It's a
because
little,
or else you lose that threshold. Once you meet that threshold, you lose the Social
right.
Security.
So it would all depend on how many hours you were,
Correct. And you
what
could
you were,
split it.
yeah,
So let's say you want
right,
to, I think it's 20 hours you're allowed to work on Social Security, if I'm not mistaken. So you could do 20 hours and then give 20 to Mary Ann, and I'm just using her
right,
example. If they
right.
even approved the 40 hours, because not everybody
Yes,
gets.
no, right.
Right.
Mhm.
Depending
Definitely,
on what
definitely.
the individual needs, even if
Mhm.
they give you 25 hours, you could give yourself 20 and 5 to Marianne. You could always split it up.
Mhm.
So that's the benefit.
Okay,
You
yeah,
choose how it's done.
okay. I thought I was right. I just wanted to kind of confirm it.
Yes, you are. Yes.
Does anyone have any more questions about this?
I did ask the woman that I deal with at CASA if she would be willing to come on and speak with us, and she said that she wasn't allowed, but that there was her supervisor. She was going to bump it up the chain, but I haven't heard back. So I can continue to reach out and see if somebody would be willing to come on to answer some of these questions that we have about
Yeah,
starting the process.
I've been trying to get somebody from HRA to do this for
Yeah.
years.
Yeah.
They don't, I think as a policy, they don't want to do it.
I can understand why, because they would probably be,
Yeah,
persecuted and attacked. But they said that they do have like a department for people who to come on and do outreach, I guess, and share. But I still am working on it behind the scenes.
we'll have to navigate to that. Yeah, we'll have to
Yeah.
find it down the road. But yes, that would be great. And
And
I
sorry,
agree.
I just want to intervene also. Maybe you want to download the app for PPL because they have an app. Sometimes that's easier to navigate than actually getting somebody on the phone. It's like it's crazy that they have an app, for these things too. But that's what they do.
Agreed. Yes, Stephanie.
Does anybody know we recently moved to Staten Island from Brooklyn, and
Mm,
do we have to? I emailed the CASA lady who never replied to my email saying we moved. Is there any official paperwork I need to fill out for that? Does anybody
probably.
know?
I suspect there is. Um, I can email you my contact at HRA down on Bay Street and
Okay.
try. Um,
And ask them, like, because I could tell them who my caseworker was who didn't reply about the
yeah,
need, needing to update any information.
yeah, that's the thing. Like,
That's a good point because if your address doesn't match your Medicaid, they'll deny you for that too.
yeah,
So that's a good
yeah,
point that you
you
just
don't want
brought.
to get caught up in that. Yeah,
And you
Yeah,
want to
don't.
make sure you did it with the DDRO too. Make sure you, within choices, that they've done a demographic change from Kings County to Richmond County.
Would that have been done with my case manager? Do you know?
Well, you would hope that they did.
Right.
I'm dealing with the case in Manhattan right now that they went from Brooklyn to Manhattan, and it doesn't match, so it's an issue.
Okay.
So just make sure. You just
yeah.
want to make
Yes.
sure that they
You
check
can't
and
you can't really trust anyone to do what they're supposed to do anymore. So
this
you
is as a,
Well,
as a parent,
have to
always a
be
parent.
you have to be a manager for all that. Yeah.
right. When I went to the HRA office, the Medicaid office, I did put the paperwork in myself, and they said it takes up to 3 months to update the paperwork. That's what they told me. So it's been like about a month, and it's
Yeah,
still not
Yeah.
updated.
I'm talking OPWDD separate.
Well,
And
I
that's
would
something else that
Okay.
I want to make sure people understand. Because I get parents asking me all the time, well, do I need OPWDD to get CDPAP? And I explain to them, no, you don't. What you need is Medicaid and you need to meet the threshold. So whether you have Medicaid waiver or
Waiver.
you just have Medicaid due to income. So just for families to understand that Medicaid is one thing and OPWDD is another, and that there seems to be a great deal of confusion in the school system and young parents because they don't understand. They think everything falls under one umbrella. And like now you have PPL, you have OPWDD, you have HRA.
alphabet soup.
Yeah.
Absolutely,
You have to
absolutely.
know your alphabet soup.
Stephanie, I would suggest asking your care manager to check choices,
yes.
and that'll come right up, or e-paces for the Medicaid. That's they have access to that information to be able to check kind of behind the scenes to see if it was completed.
I'd like to say, can you hear me?
Yeah, we
Hi,
hear you.
Vilma.
Yeah. Hi, good morning. I'm so sorry I was kind of late. I was having some difficulties with the link getting into the meeting. But no, regarding OPWDD, I'd like to say that you should have your case manager request change a borough. Yeah, she should submit the DDP1 to notify us
Okay, thank you.
that the
I will
individual
double
moved.
check on that. I think she did, but
Yeah,
I'll double check on that.
sure.
Yeah, there's a huge checklist of stuff you need to do when you move, when you change anything, when you go into the hospital, when you get out. That's another thing, like Fabiana. If your loved one goes into the hospital, you have to alert PPL immediately. That's another rule. Like, there's a million.
Why?
Get paid to care for that person while they're under the care, medical care.
Right. Yeah.
Because then
You
it's
won't get
double
paid,
billing.
did you say?
No, you can't get paid while your loved one is in the hospital.
Even
No.
the
And you're
worker,
supposed to.
even though, let's say my son would never be able to be left alone, like even
Right.
Right.
So
They
he
don't
would
care.
need 24-hour
They don't
care.
care. No.
They don't care.
Nope. Yeah.
Yeah. So God forbid your son goes to the hospital, you cannot get paid. Even if you're sitting there with him 24/7, spoon feeding him, they don't care.
Yeah.
The hospital assigns a social worker, so that's
Yes.
for sure. I've been there with Pasquale, and he had a social worker 24/7. It was like, all right, I'm here, but they assign a social worker to sit next to the child.
At
Right.
2 in the morning, they're gonna get up when he's bouncing off the walls.
Yeah,
They're
yeah,
gonna be with him.
They stay there 24/7.
Supposedly, yeah. I can't. We
Yeah,
can't guarantee the
Interesting.
parents.
quality of them, but yeah, they're supposed to. They're supposed to do that. But
Yeah,
the
they're
fact
supposed to assign somebody, like either a
as
home
a
health
Hmm.
aide.
as a
Yeah,
PPL employee, you cannot be paid while your loved one is in the hospital.
In my
yeah, parents.
opinion, just
I
don't
learned that
caution
from Medicaid.
find them just
The,
causes more confusion.
Yeah, just like
no,
you
it's
can't have a
because the money goes
have
to
a
someone else.
respite person in there either.
Right.
Just like group homes, if they had their DSP at the bedside, they don't, they can't get paid for that.
That's right.
Yeah, that's
No,
why.
parents, listen. Don't get scammed it. The reason your home health aide or your CDPAP parents cannot get paid if the kids are residing in the hospital is because the money from Medicaid supposed to pay you goes to the hospital, and hospital supposed to assign someone else to take care of kids at the entire time residence.
Yeah.
Right.
Okay, if the hospital didn't do so, record it wherever with your phone, with the paperwork, with a third person as approve it, record it, and then let Medicaid know.
Yeah.
All right, somebody's making money on your kids.
Yeah.
Yeah,
Great.
that is another disappointed point on me.
Right. Does anyone have any other questions
I,
on?
yeah, hi. This is Jay Giambroni. I have a
Hi.
question. Hi. Are you? Did you say earlier you were going to add the steps to going through the whole process to the email link?
Well, I have it in the chat right now. It's there.
Okay.
It was a suggestion made that we put something together, so I could try to see. I'm sure something already exists, but I will try to see maybe we could put something together to help families start the process.
Yeah, I just put the link again in the chat, and we will down the road work on putting together some sort of Q&A per Angelica's suggestion.
I also think it would be a very good time to bring in somebody that can speak on alphabet soup. Because, my God, I remember when I
Yes.
started and Dawn used to speak in letters, and I was like, I don't know what you're saying. And most people probably have no idea what.
So
So
the
if
There's
you're doing
community
it
actually a
here,
document.
the
There's a
yeah,
community
document out there
outreach
that has
committee
it.
is actually taking
yeah,
that
but
on.
people don't
Community
know that.
community
Like maybe
outreach.
a web.
Yeah, Julie, community outreach, Michelle was talking about doing some sort of a feature where we send out like an acronym of the day or something like that.
Yeah.
And
I'll do a webinar
and
on it.
to
We'll
teach
do it.
parents on social media, to teach parents all the different acronyms and kind of like get them familiar with the alphabet soup that is now part of their lives.
Parents, a
It's a
parent
good.
of New York
Better
State.
email you something just to
No,
use it.
Parents, a parent of New York State. We used to give that out. There is an actual document that that I don't know who it's from, but it lists all the acronyms and it goes through everything. Jackie, remember that? I mean, it's going back. I don't know if it's still out there, but it definitely exists.
And we
It does.
also have one on the SIDDC website.
Yes, there
There
is.
is an acronym page, a link there that has a bunch of acronyms. It
But the
hasn't been updated in a
No,
while.
I was just going to say though, the acronyms have changed because, you know, 10 years ago, there wasn't the IDDSL, there wasn't PPL, you know, you know, everything changes its format. And a lot of and I'm in the school, so a lot of our young families, they're just in, you know, deer in headlights. So if we could give steps too, you know, we're like that kiss, you know, we keep it simple,
Yeah.
simple.
So
Keep
that's a
it simple,
project that
simple.
community outreach is taking on, and they're going to work on kind of an education campaign for teaching everyone the acronyms. So
All right,
yes,
that's cool.
Jackie, anybody under 21 is not eligible anyway, so just, it's.
Well, for the parents,
they're
if the
not eligible as
parents,
parents, but I had CDPAP since Matthew was 9.
Right, that was the old
I
way.
just couldn't be. I
right,
just couldn't be his worker. Yeah.
right.
Right, that was
So,
the old way.
right, because that
A
was
lot of
something.
parents with young kids are losing their services.
Right, especially now that OPWDD is not approving the enrollment in waiver service. And where, waiver respite, they're not being enrolled, they're just getting FSS. So CDPAP is so critical to so many of these young families that they understand that they can access it if they have the Medicaid that they need in order to get it. As well as, you can have OPWDD eligibility, get family support services. You don't have to be enrolled in a Medicaid waiver respite because OPWDD is not approving that. But if we have families who need that CDPAP and they could do that, and it's not the parents, but it's maybe somebody else, that could be a way for families to get the support because that's what we're looking for a lot of our young families.
Hi, this is Jay again. I got one more question. If I happen to get through this whole process and get to the point where there's workers involved, can my wife and I both be workers, or does one of us have to be a supervisor?
So
You could both be workers.
you
As
both be
long as
workers.
the
If you could get another person to be your supervisor.
Right. Somebody has to be the individual's like proxy, and that person cannot be the worker. Whoever's representing the individual. So if I'm representing, Ben, I cannot actually work for Ben. It would have to be Mary and Annette. But you always have to have one person being the individual's representative, speaking for their needs. If the person cannot speak for themselves or make decisions for themselves. And then
Yeah.
you and your wife can be workers.
Originally, I was the representative when I had other workers. Then, when I started being a worker, when Matthew turned 22, my husband became the representative.
I can sign
When
him.
last year, when he became a worker too, my mother became
Became
representative.
yes.
So, we're bouncing the representative around to make sure that, we can be the worker.
How hard is that to do? How
It's
hard is
not
that
hard. It's your
to go around?
choice.
It's
That's
just
the easy
paperwork.
part.
Yeah.
That's the easy part.
Well, the easy part
In
in the sense
comparison.
that you're the one choosing who the representative is if if you and your wife are the workers.
Okay.
Yeah, the
Every year,
representative has to be able to, sign approve your weekly timesheets
Yeah.
Okay.
on an
every
app.
year at renewal, you can make those changes. That's not,
Yeah.
the social worker comes in and asks you all the questions. So you don't have to do it the same moment. Just wait until renewal and you can make all those changes.
Now, when it comes to the M11Q, is that provided every year to get like a
Yes.
renewal?
Yep.
Correct. Yes.
So you have to go. Is that a simple mail-in, or is that something that
No.
you got to go through the whole process again?
No,
It sounds
it's a medical form that you have to take to the doctor and have to have it completed, meticulously completed, and not miss a single thing and not have one thing be blurry or
illegible.
illegible or anything like that. It has to be
Missing.
perfectly done. And then when you have to submit it, you have to make sure that you actually get it in the hands of somebody at HRA, either by email or by fax or by hand deliver. And you have to make sure you get some sort of receipt that they said they actually received it. Because if you just stick it in the mail and think it's going to get there, somebody will lose it on a pile, or they'll claim it got lost in the mail or something like that. It's one of those things where you don't leave it up to fate.
Marianne, I don't know if that changed because like when I used to do it, they used to hand it to me and I would hand it in. They didn't have to go to HRA. So I think if you use a facilitator, you can hand in your MLMQ.
I had to I've had to go to HRA directly with it for the last 10 years at
I'd
least.
go right to Brooklyn. Next year, I'm going right to Brooklyn and I'm handing it to somebody with a signed receipt that they got it. I'm not even going to play around.
I
Because
physically
the
handed
fax
it
number,
this year to somebody on Bay Street.
the numbers also the other thing to be mindful of is the fax number that they list on the paper is not the right fax number.
Right.
The email that they have there is not the right email. And when you call, they'll be like, oh, well, that's not the right number. Oh, sorry, I was absent that day from mind reading school. So I would definitely suggest walking it into somebody in the Brooklyn office.
Yeah,
Annette,
And
you
it's
have
only good for 30
tomorrow.
days. And
Annette,
it's
you
only
have
good for
nerve
30
missing
days.
school. You have nerve missing mind reading school. But I have a quick question.
Imagine.
Fabiana, you mentioned a PPL app. Is there a way that maybe documents can be uploaded through the
Nope.
app? Is that something that's feasible?
Nope.
Nope.
It's just for time.
I mean, you can do it. It's supposed to be, you're supposed to be able to. That's the whole point of it, that you're supposed to be able to, but does it actually work? And sometimes yes, and sometimes no. But that's why I was saying they used to hand it right to me, and I used to make sure it got into the right hands. They didn't have to go through HRA and all these craziness because I knew who to send it to and what to look for and what was inaccurate before I would even send it out. And that's what PPL should be able to do. All the facilitators is be trained well enough to recognize any errors
Ever
before
since
we
I
even
got
send any.
burned that one year where my services got cut off, I don't leave anything. I don't trust anyone
Chance.
anymore, and I make sure it's in their hands because that
Right.
I was a good 4 or 5 months without services.
Yeah.
The phone number that's listed on the form when you receive that envelope with the M11Q, I called and it's the phone number to the Adult Protective Services.
Okay.
Yeah, and the fax
Yeah,
number's not right. I don't know where that's going. So you're faxing
There's
over all
two
personal
numbers.
sensitive
There's two
There's two
information.
numbers. Yeah.
numbers. One works
Yeah.
and one doesn't.
And that's
Right.
a
One
HIPAA
rings.
violation, by the way. That's a HIPAA violation because
Oh,
you're
big time.
submitting very personal information with, date of birth, all these identity,
Social Security, Medicaid.
absolutely, to something
And
that
nobody's taking
Is
nobody's
out
anybody
in the
going to take
universe.
so
responsibility
what
for
HIPAA
that?
violation? Who cares
no,
it's a HIPAA violation? Nobody's taking any accountability or
no, it's
responsibility for
disgusting.
it.
It really is disgusting. Well, maybe everybody needs to write to the governor.
Yeah,
Yeah,
okay.
she's
She's
listening.
busy.
Yeah.
You know what? I believe that is
On the
something we should
answer.
bring it to local DA, you know?
Yeah.
Yeah, because they gave us fine. They gave agency fine if we violation HIPAA for every individual for $5,000. They never inspect their own people.
Yeah.
You know what I'm
Wow.
saying?
And they never will. And they never will.
So if no one else has any more questions on CDPAP, does anyone have any new business? Any
I
programs or
put
things?
some
Jackie, do
info.
you have to do your spiel?
I'd love to do my spiel. I will tell you that I'm happily saying that NYSED has pretty much used most of their funds for, if not all of their funds, for reimbursement for this fiscal year. And we are encouraging other families to try to connect with either ADAPT, AHRC. I know ABSP was also running pretty low. I spoke to Andrew at the last resource fair, but we do have sports and recreation tickets. I'm going to put information in the chat. Come July 1, funds replenish and we start over. Families who are looking to get OPWDD eligibility, we encourage you to reach out to us. If you do not have Medicaid for those evaluations, I obviously everybody who's on this call, most of the people we know have this information, but please share it with those who do not. And I'll put my contact information in the chat as well. Thank you, everybody.
And Miriam put her spiel in the chat. I saw that.
I put some information. Lifestyles for the Disabled is having a flower plant sale, sorry, at the greenhouse. I put that in there. We're also doing a really wonderful event for Fleet Week. We're hosting an event at the Staten Island Zoo where we're going to be honoring some veterans and current service members, and you can purchase a shirt to donate to help. So all that's in the chat. So any support would be greatly appreciated.
Yes, yes, very good. And
uh,
Wednesday night, Julie has a wonderful event at Grace Foundation.
right. We have on Wednesday, it's open to the entire community. It's not just based on autism or Grace Foundation for that matter. It's a community meeting. I've started these, and so far they've been very meaningful to people. So it's growing. That's nice. We have the 122 Precinct Council will be representatives there, as well as other speakers that are really well versed with options for people with disabilities. So I encourage everyone to go. We have an idea exchange so that everybody gets to put an idea in a box. Then we go through the ideas, and then your voices are heard. Specifically to the 122 precinct, we'll be going through any ideas that were geared towards them. So I put in the flyer. Everyone is welcome. Just please RSVP, because I need to know how many chairs to put out. That's really the answer.
And I encourage everyone on Friday is our SIDDC General Council meeting. The flyer is in the chat. Anyone else?
Stephanie, have you ever attended the Health and Clinical Services Committee?
No, I haven't.
SIDDC has a Health and Clinical Services Committee where they often share different information on doctors and whatnot, but that might
wonderful.
be a good resource for you to connect with as well.
Thank you. Is that in the chat somewhere? Or?
It's on the website. I don't know, Cynthia, do you have a current flyer? I don't know what their upcoming meeting is. But if you go to the website, siddc.org, you can find it there.
Okay, great. Thank you.
They're not meeting this month because of the speaker on Friday.
I appreciate it. Thank
so even if you attend the General Council on Friday, being it is a health and clinical topic, the health and clinical people will be there to introduce.
Great.
So if you're able to join on Friday, you could probably pose your questions Friday.
Great. Thank you. Thanks.
Okay. If no one else has anything, go.
I do notice. I'm sorry. I noticed.
Go ahead,
Janine Kirshner. She's our DDP4.
I introduced myself, Wilma.
She introduced at the beginning. Yes.
Oh, good. I'm so sorry.
Yeah, we did introductions at the beginning, so
I figured so, but I just wanted to make sure.
Anybody else that I didn't that wasn't in at the beginning, we did do introductions. So
okay, thank you. Good.
I just wanted to say hi to everybody. I got on late. It's Christine. Hi.
Okay, everyone. So have a great week. And if you're able to attend any of those events and things that we have coming up, we'd really love to see you there. Thanks.
Thank you. Cynthia, send me the recording, please.
Thank you.
Bye.
Thank you, everyone.
Okay, thank you. Bye.
Thank you. Bye-bye.
Bye.